to call us. Mike Pero Real Estate.
Do you brush your pet's teeth with information straight from the horse's mouth? Here's vet Alex Melrose. And this is my retired greyhound Ben, aka Ben Wolf, aka Accelerate, aka Suki Suki Puppy Puppy Lala. That's a lot of names for a dog.
It's a comprehensive name and it fits the extravagance of his collar.
So how important is this? I mean, we tend to neglect that area of our pets, I imagine. You don't really get in there with a toothbrush, do you?
Sure do. Studies show that although about 4 in 5 pets have some kind of dental disease, as little as 1% of people actually brush their dog's teeth. So, yeah, we're not doing too much about it, and it's a very, very common cause of illness in pets.
Right, this is obviously for cats as well, it's an issue.
Yeah.
But what other knock-on effects can it have? I mean, we think of maybe a toothache or it needs a filling or something, but can it actually lead to much worse things with gums and...
Definitely can. There's a lot of information that's come out of the States recently that shows that you're way more likely to develop kidney disease, liver disease, heart disease as well. So what happens is that the bacteria that are in the mouth actually manage to basically aerosol and then travel through the bloodstream around the body and cause problems in other areas.
Right, I see. So it's quite... So we're talking kidneys and blood poisoning and things like that?
Yeah, for sure.
What do you do about it as a vet, then?
Well, first of all, I encourage owners to try and have a look themselves, you know. So you don't have to... We're too boring, obviously.
He's so clever, this dog. Right? He knows you're about to put his your hand in his mouth, so he's just been licking his privates. That'll put you off.
It's working. It's working. So what I encourage owners to do is actually just to try and lift the lip on their pet's mouth. And you don't have to try and open the mouth. You can just pull that lip back, and in doing so, you'll see that it exposes quite a lot of brown tartar on his teeth there. It also allows you to look at his gum line and see whether his gums are a little bit swollen and a little bit red.
So what do they look like to you?
The gums aren't too bad. There's a thin red line along the base of them which shows that gingivitis is just starting.
Really?
And then you've got that real brown discoloration of especially on the canine, on the large tooth there. You can see it quite clearly. So yes, he does have some dental disease, and already it's starting to extend down under the gums and get into areas where it can start to spread around his body.
Wow. So does that make me a neglectful owner?
Not at all, man. I'm not here to judge. No, not at all. You're a great owner, but it just illustrates, you know, as pet owners, we often don't open pets' mouths, you know. It's not a common thing to do, but we should be doing it. We should be getting our pets used to it, and we should be checking there regularly so we know what's going on.
Well, this is different for me as well because he's a mature dog. He's nearly 4 years old.
Yeah.
So he's not been brought, and a working dog as well, so he's not been brought up with that kind of affection. So is it a good idea with puppies?
Get them used to it early. So with pups, you know, you want to get them used to you touching their ears, their paws, especially. A lot of dogs are a bit touchy about their paws, and get them used to you opening their mouth gently, pulling back their lips, having a look around the back teeth as well. He's been very helpful now.
So what would you do if we were in your surgery now? Does he need to be dealt to?
Yeah, he needs those teeth cleaned up. Otherwise, we're going to get cavities in there. We're going to get possible tooth root infections, and as I said, we can, you know, even shorten his lifespan by allowing those bacteria to spread around. So what we do as veterinarians is we would give him a thorough physical. We'd probably recommend a blood screen just to check out that everything was fine, especially with his history where you haven't had him from a puppy. We want to know if there's some sort of underlying problem before we put him under anaesthetic and actually use our machines and instruments such as these to get all that tartar out, and even more importantly, to get up under the gums and deal to all the bacteria that are sitting in that pocket there, which you can only do if they're anaesthetised.
What can I do? I mean, let's just say I take him in, you anaesthetise him, you rake all that stuff out.
Yeah.
You said gingivitis as well. What do I do about that?
Yeah. Well, part of the treatment for gingivitis is for us cleaning that gingival pocket.
It all out. Yeah.
Yep. So we do it physically, and then your job as a good owner going on from there is to put him on the right kind of food that is going to help with his teeth. So there's specific dental biscuits that help them use their teeth and abrasively clean the teeth. There's dental chews that you can give them. I think you mentioned that you might be trying some of those on them already. Things like Dentisticks, Greenies. There's quite a lot of really good products like that they'll play with as almost like a toy, but it's a lot of benefit to the gums and the teeth as well.
What about bones? Are they any good?
Yeah, they are. You just got to make sure you get the right kind of bone. You don't want little bones that are going to splinter up. And also, some dogs handle digesting bones really well and some don't. Some of them will really upset their stomach. So it depends on the individual dog.
What about cats? Because we better not leave the cat owners out.
Yeah, true. Cats pretty much in the same boat. Obviously, I wouldn't be recommending that you clean cats' mouths with a toothbrush. They're just a little bit, you know, they're not compliant like dogs. They've got a mind of their own, so it's a little bit harder. There's some cats you can do it to, but for them, you've really got to concentrate on diet and hard things for them to chew on. With him, with a guy like Ben, who's so well behaved like this, he's really making you look like a fantastic owner. You know, there's no reason why you couldn't get him used to some veterinary toothpaste and then perhaps a little finger toothbrush that we use. Sometimes it's like a rubber thimble that you have on your finger with some bristles. Get him used to that, cleaning the outside of the teeth once a day just for a couple of minutes. And then once he's used to it, you can progress onto a really soft sort of toothbrush, like a human baby's toothbrush or something like that.
What's the difference? Why couldn't I just use Colgate?
Well, it's a good question. The real issue is that he's going to lick it and eat it.
Right.
So he's going to be trying to digest toothpaste, and human toothpaste is not designed for that. So it can really upset their stomach. So when you get veterinary toothpaste, first of all, it's flavoured differently, so it might be like beef, you know, which is nice. Yep. Nice for him.
So I'm going to cover my hands in beef and then put them in my dog's mouth.
Pretty much.
Okay.
Yeah. So it's a real challenge for you. Although I don't think he looks particularly dangerous.
I got no worries with this fella.
Yeah, yeah, exactly.
You're sookie la la puppy, aren't you? Obviously, you know, vets, there's a lot of time involved. This is quite costly, right? So how much would I be looking at if you had to put him under and sort those teeth out for me? Yeah, well, as we've discussed, you need to do it under a general anaesthetic, so that incorporates quite a lot of the cost. And typically at our clinic, our dental cleanings like this start from, I think, $300 to $400 is the cheapest you're going to go for. In his case, I would strongly recommend that we do some blood tests as well, because we don't know all his history. Right. And so we want to know if there's any underlying problems before we put him under a general anaesthetic. So that's going to add a little bit more cost as well. But that's kind of what you're in for. Prevention is obviously the way to go here then. Get the thing on your finger and get in there. Yep, so you can help with diet, you can help with dental chews, you can help with regular cleaning, and then by doing that, you're not going to be coming in to see me very often. All right, I do like your company. Thank you. Yeah, I know what you're saying. Thank you, Alex. And now, back for a third week. He's the cat I'm contracted to say I love dearly. He's not mine, he's not yours. He's Simon's cat.